All right, we're taking it up from there. Dr. Oguntimehin Olukayode joins us now. He's a permanent secretary, Lagos State Primary Healthcare Board, to continue our focus and awareness on this Ebola threat. Thank you for coming on this morning.
Thank you. Good morning.
I beg your pardon, Oguntimehin. Yeah, my error. Well, looking at where we are today, we know that they've set up a lot of centers. We know about the Yaba and then the continuous message out there for people to do what they have to do. But about those emergency numbers and the response to it, how is the response coming on? Are people calling the numbers? What have you noticed from those?
Yes, people are calling the numbers. Sometimes I even think they are over-calling. And to try and do that, we've tried to set up a helpline. It was like the day the salt rumor went about. I woke up in the morning and I had 410 missed calls on my phone. And it has always been like that. So people are coming in. There are aids on what do you call it, on a Facebook page. There's the Ebola helpline that is manned 24 hours a day. So people are getting more and more aware. But what is more worrying to me is that we are panicking.
Shouldn't we be?
Yes, we should. There's no. I'm not saying we shouldn't worry, but we should not panic.
You say we're panicking. What are the signs of panic?
What I meant by panicking is that people call in to ask all sorts of questions in terms of, do you stop people from going into mass transit bus? Do you ban Okada? Do you need to stop football matches? And so on and so forth. Yes, we know it is a disease that is gotten by bodily contact. But what is always more important in this is that the person who is going to transmit it to you must be sick. If you're not sick, you cannot transmit it.
Can I be walking around, even if it's the first day, if I'm sick?
The first day usually you start with a high fever. And by the second or third day, which is where we think the transmission really starts, you're probably moribund. So you can't be walking about, taking public transport, going to watch football matches, and so on and so forth.
So it's very important that people have it at the back of their minds that if people are walking about, they look pretty hale and hearty. They cannot be transmitting the Ebola virus.
Yes. People should have that at the back of their mind.
But I thought they said the, what's the word now?
The incubation period
Differs from individual to individual.
It doesn't matter whether it differs. You see, what we don't have is an asymptomatic Ebola illness. You don't have that. You have to be symptomatic. That's part of the case definition. So if you're not symptomatic, you cannot be classified. And then in the sense that, again, I'm appealing to most of our health practitioners. Yes, we do know that majority of these symptoms are the normal symptoms of infection in varied forms: vomiting, fever, diarrhea. But there always must be a history. And I'm really appealing to our health practitioners, like I say, that we should go back to the basics. Let us take the history of patients in front of us. Don't let us say, as soon as the patient comes in, is vomiting, is diarrhea, it's Ebola, go. Don't attend to. That way we will not be doing ourselves any good. And that's why I mentioned the word panic, because when you panic, you stop thinking.
Don't you think the leadership, I mean government for instance, the response teams are also aiding this panic by not responding when these calls are made? Because we've had several complaints here that those emergency numbers are called over and over again and no response. And even when you get a response, nobody shows up for a while or for a long time.
The question is always this: you call me. I happen to have one of those numbers. You call me. I'm having a conversation with somebody. And I can assure you, if I have a 5-minute conversation and I look back on my phone, I will have close to 10 to 15 missed calls. So everybody, all calls cannot be answered. Again, that's why I said people should not panic. I can assure you again that a good percentage of those calls are, is this the Ebola help number? I just wanted to be sure that it is. Is it true? And you keep on getting bogged down in things that do not really matter. So we must, that's why I said, that is what we need to take away from this. We must stop panicking. Yes, we'll try as much as possible to answer everybody. If you call and nobody answers, send a text.
I was going to ask you that.
Yes, send a text. And usually we'll go through our text and reply. People go on WhatsApp to send me messages. I look through them, I answer. And I'm sure that happens all over. But what is really, really, really more important is go to the helpline. That is manned 24 hours by people whose sole job is to respond. Go on www.ebolaalert.org, which is an interactive forum, and ask questions. People are there to respond to your questions. So we should try, and it's a deadly disease. Everybody knows that. Everybody knows it's a big problem, but it's a problem that we can solve. That's what I always like people to take away. It has always been solved, and it will be solved.
Just a moment, though. You talked about, one of the things you talked about is people panicking, but a lot of people will say that from what we're seeing, the increase in the number of people under surveillance, I think was last week Friday was 139 or thereabouts. Today is 177. If those people were already under surveillance, because we have new people who were under surveillance now being confirmed. Now, the latest figure we have, number of Nigerians who came in contact with Mr. Sawyer, 9 of them are confirmed to have the Ebola virus disease. And it would seem that we're extending the number of people whom they have contacted, the surveillance and number of people whom they've contacted. But one would say that those people could not have infected the virus, or sorry, transmitted the virus while they were still in their homes under surveillance. After all, they were hale and hearty. Unless, of course, we're saying that there is something wrong with our surveillance system.
There's nothing wrong. The ideal thing to do is that if you pick a case, you must survey people who has come in contact with that. Actually, that's the way this disease stops. Make sure it never gets to the next person. So everybody that has come in contact with that case must be. Let me give you a little bit of cheery news. As of yesterday, we have cleared 39 people that came into primary contact with Mr. Sawyer. 39 people.
Cleared?
Yes.
After how many days?
After 21 days. Because what we normally do is that the last day that we're going to clear people will be on the 25th that he died, right? So in another 21 days, which is another maybe 3 days now, to the 25th, virtually everybody who came in contact with Mr. Sawyer as a primary case who has not fallen ill will be cleared.
In clearing